Do you want to tell us about your experience of having cancer as a youngster?
Having cancer in the late 80s, early 90s was not much fun. It's not fun now, but back then it was a lot worse. And the same can be said for, decades prior to my experience. But when I started chemotherapy, the antiemetics or the medications that they had at their disposal to help with the nauseating effects of the chemotherapy weren't very good. To give you an idea of what a day in the life of a childhood cancer patient was like, I was on a 3-week cycle of chemotherapy, whereby for the first week I would be in hospital on chemotherapy by IV, and then I would go home for 2 weeks to recover. And in that first day or two, I would literally vomit every 5 to 10 minutes, all day. I couldn't sleep because I was just vomiting through the night. They had to use sedative drugs to sedate me so that I could sleep, and they had to have nurses monitoring that I was sleeping in the right position so that I wouldn't choke on vomit while I was sleeping. The fatigue that comes with chemotherapy anyway was just so much more extreme because I couldn't sleep because of the vomiting, constant vomiting. It just didn't stop. And then, by about day 3 of the cycle, it would be that I would be vomiting less, that, maybe once an hour, once every couple of hours. And by the end of the week, maybe just 3 or 4 times a day. And I had chemotherapy for about 18 months, I think. And just as I was getting towards the end of my treatment, I started looking around me, and all these new patients weren't vomiting, hardly at all. They just weren't vomiting. I'm like, they're losing their hair, and they're clearly sick. They've got cancer just like me, but they're not vomiting. Why? So I started asking them, and they were on a trial for a drug called ondansetron, which any cancer patient would know about. It's a very effective anti-nauseant medication that really helps with chemotherapy. It just helps make the chemotherapy more tolerable. If we didn't have ondansetron now, I wouldn't have gone through chemotherapy again for my second cancer, third cancer. I would never have been able to do it again. I couldn't have gone back there. So all these kids, I'm looking around and they're all healthy. I'm like, I want some of that. I want what you're on. And so I asked, and it was a trial drug at that stage. So I wasn't eligible for it because of the date that I got diagnosed. So even though I had suffered quite a lot, and I thought that I would benefit from this drug, I wasn't eligible for it. And the funding has to be cut off somewhere, and the clinical trials have to start and stop somewhere. I understand this. At the time, I didn't understand that. And I got up in arms, and my dad said, well, if you're angry and you really want it, then do something about it. And so I wrote to the Health Minister and the Prime Minister at the time and explained my situation, and explained what this drug was doing for these newly diagnosed kids with cancer. And, I said in no uncertain terms that I thought that I was entitled to it, and that I would not accept no for an answer. And fortunately, they, I don't know how, but they did permit me to have that drug, ondansetron, for my very last week of chemo, my very last cycle of chemo. And it gave me a glimpse of how tolerable chemotherapy could be with effective anti-nauseant tablets on board. So although the research at that stage hadn't found a cure, it had found a drug that made the potential cure that was already there, chemotherapy, made it so much more tolerable and so much more manageable. And through ondansetron, people lose less weight. They stay healthier and stronger to fight the cancer, and keep their appetite, and can fuel their recovery. And it just makes a world of difference as far as personal comfort is concerned. So to have personally experienced not having a drug, like having a situation where a drug wasn't available at all, to then seeing other people have that drug and not being able to have it myself, to then being able to have it myself, I really do understand firsthand the importance of new treatments becoming available, not just to save lives, but to enhance quality of life for people with all sorts of illnesses.